Hello students, good day to all of you. So in today's topic of head and neck, we are going to discuss about the eyeball. So moving to the learning objectives of the eyeball for today. So we will start with a small introduction about the eyeball and then certain basic terminologies or definitions with respect to the eyeball. Then followed by that we are going to actually discuss in detail the structure of the eyeball, so which is mainly made up of the three tunics or coats. So that is the outer coat forming the sclera and cornea, followed by that the vascular coat, which is formed by the choroid, ciliary body and the iris, and then you have the nervous layer of the eyeball, that is the retina. Then we will discuss in short about the structure of the lens and then the chambers of the eye, and with that we will actually conclude. The clinical aspects I will discuss in between as and when applicable. So now you are able to see the eyeball. The eyeball is actually a spherical or globular structure which is mainly your organ of sight. So it comes under the special senses and it is the organ of sight, and it can be compared to the camera. Okay, so which has almost all the parts of the camera. So it is situated within a bony socket which is called as the orbit. Okay, and the anterior part of the eyeball projects beyond the orbit but only from the laterally, whereas the anterior and the superior and the inferior margins are somewhat protective, but laterally what happens, if you project, it will pass behind the cornea. Okay, and then within the orbit it freely moves. Okay, and lot of fat is present, orbital pad of fat is present, which gives a cushioning effect to the eyeball, so that during the various movements it does not actually, any mechanical injury is actually avoided. Okay, then it developmentally, if you look at it, the optic, mainly the cup, is actually a prolongation from the forebrain vesicle, and more precisely it is actually from the diencephalon. Okay, so the eyeball is also considered as a moving brain. Okay, and all the three tunics, mainly your the sclera of the eyeball is actually derived from the dura mater, and the choroid is actually derived from the arachnoid and the pia mater, and your retina is actually the prolongation of the diencephalon. So it is actually called as the moving brain. Okay, so the eyeball is actually surrounded by a capsule which is called as the Tenon's capsule. Okay, so these Tenon's capsule actually separates the eyeball from the fat surrounding it, and it is actually called as the fascia bulbi. So the other name for the Tenon's capsule is actually called as the fascia bulbi. Okay, so the eye is actually a globular structure, and it is actually comprising of two spheres. One sphere which is in the front is very small and forms the 1/5 of a sphere called as the cornea, and the remaining 5/6 is actually formed by the sclera, which is the larger sphere, posterior large sphere. Okay, now coming to the basic terminologies, certain terms we have to first understand. What is actually the anterior pole and the posterior pole of the eyeball? So the anterior pole and the posterior pole of the eyeball is, anterior pole is a point on the most convex part of the cornea, or the center point of the cornea, followed by posterior pole is actually the point of scleral curvature. Posteriorly a point on the scleral curvature. So if you join these two poles, the anterior pole and the posterior pole, then you get what is called as the optical axis. Okay, so from the anterior pole to the posterior pole, you see the optical axis. You're able to understand that is somewhat aligned with the axis of the orbit. Okay, because you're able to see the orbit are actually two bony cavities which is pyramidal in shape, and it is somewhat projecting like a binoculars. Okay, then what is visual axis? So visual axis from the anterior pole to a point on the posterior wall of the eyeball, which is called as the fovea centralis. So you see a depression there which is called as the fovea centralis, which is lateral to the optical posterior pole, or somewhat it is what do you call lateral to the optical axis. Okay, so both the visual axis and the optical axis, both the visual axis and the optical axis, what happens is will merge when the eyeball is slightly abducted. Okay, so fovea centralis, as I told you, you are able to see a depression in the posterior wall, and it is also called as the macula or yellow spot, because it is mainly populated with cones, and it is also area of discriminative vision. Okay, you can also call it as a yellow spot. And equator is actually passing halfway, line passing equidistant from the two poles is actually called as the equator. From anterior pole to posterior pole if you join, and midway between that, any plane passing through the midway between that is actually called as the equator, whereas the meridian is any two lines, okay, joining the poles, any point joining the poles and right angles to the equator. So right angles to the equator means it might be, if the equator is running transversely, so it is should be right angles to the equator. It might be in a sagittal plane. The meridian can pass sagittally or transversely or even obliquely. Only thing it should actually connect the two poles and right angles to the equator. Optic disc is actually, I told you, from posterior pole of the eye, from where the optic nerve emerges. That is actually called as the optic disc, and it is also called as the blind spot, because rods and cones are actually absent here. Now, coming to the structure of the eyeball, the outermost coat, three coats we have. So, or the tunics, it is also called as the tunics. The outer coat is actually called as the sclera, and then the cornea. Okay, whereas the cornea is transparent and the sclera is opaque. Then deep to the sclera, and you have the choroid, the vascular coat, middle vascular coat, and deep to the choroid, what you see is the nervous coat, which is the retina. You're able to understand. So the retina, you are able to see it is also serrated. No? I will be discussing about this, but just since I noticed in this picture, it is serrated anterior margin, that is called as the ora serrata. You're able to see that is called as the ora serrata. Beyond that also, the retina extends anteriorly, but only the non-cellular part extends. Okay, so beyond the ora serrata, so only the non-cellular layers of the retina extends. Okay, now as I told you, when between the two eyelids, what you see is the cornea. Cornea is transparent, so you won't be able to make it. And the part of the sclera, what you see as the white of the eye, they are actually covered by another layer which is called as the conjunctiva. Okay, so the conjunctiva forms a membranous sac. It reflects on the internal aspect of the eyelid. Eyelid is also called as the palpebrae. So internal aspect of the eyelid is the palpebral conjunctiva, and then over top of the eyeball as the bulbar conjunctiva. Okay, so the place where the palpebral conjunctiva is continuous with the bulbar conjunctiva is called as the fornix of conjunctiva. Plural is actually called as the fornices. Okay, so you have a superior and inferior fornix. So it is nothing but the folds where the palpebral conjunctiva is actually continuous with the bulbar conjunctiva. So that includes a sac. Okay, so you and mainly the certain cells are present like goblet cells, and they secrete mucus. Okay, so mainly it actually secretes the mucus, filled with mucus, the conjunctival sac, and also from the glands, lacrimal glands, the lacrimal fluid is secreted. Okay, so the conjunctiva is actually present anterior to the cornea. Okay, and the conjunctiva, you also have vessels in the conjunctiva. Okay, so there are also some blood vessels in the conjunctiva. Next, coming to the outermost coat. So what you see is the outermost coat is actually called as the sclera. So the sclera is actually a tough fibrous coat because it is mainly made up of dense collagen fibers and forms the posterior 5/6 of the outer fibrous coat, and you call it as the white of the eye. What you see anteriorly when you between the palpebral fissure. Okay, so the sclera is actually continuous anteriorly with the cornea, and the junction between that area is actually called as the sclerocorneal junction. There is also a sulcus which is called as the sulcus sclerae. Okay, and it is surrounded by a capsule. The sclera is mainly surrounded externally by a capsule, the Tenon's capsule or the fascia bulbi. So here you are able to see that is the Tenon's capsule, the bulbar fascia. Okay, and between this Tenon's capsule and the sclera, you have a space which is called as the episcleral space. Okay, so between the sclera and the Tenon's capsule, and the Tenon's capsule separates the sclera from the orbital pad of fat. So the sclera receives the insertion of the recti muscles, four recti in front of the equator. So equator will pass exactly equidistant from the anterior pole to the posterior pole. So in the posterior pole, you are able to see this area where the optic nerve pierces, and that is called as the optic disc. So the place where the optic nerve pierces the sclera is actually uh, sleeve-like. Okay, it is actually sleeve-like, and it is somewhat weak at this area. So it receives the four recti and in front of the equator, and two oblique muscles behind the equator. Okay, so the space between the Tenon's capsule and the sclera is actually called as the episcleral space. And of the three coats, you are able to see the sclera is the most thickest. It is a outer fibrous coat with the dense network of collagen fibers. So it mainly is responsible for maintaining the shape of the eye, and it also protects the inner two layers, that is the choroid and the retina, and also it is responsible for maintaining the intraocular pressure. Okay, so internally the sclera is separated from the choroid. So with the blood vessels, what you are able to see, lot of blood vessels. So that is actually called as the choroid, and both are separated by the perichoroidal space. Okay, so there is a space which is called as the perichoroidal space. So the sclera is mainly pierced. Posteriorly, you see what pierces is the optic nerve, and within the optic nerve fibers, you see the central artery of the retina and the central vein of the retina. So as I told you, where it pierces, the sclera is sieve-like, and it is called as the lamina cribrosa. Okay, that part of the sclera is somewhat weak because it is pierced by the optic nerve fibers, and it is called as the lamina cribrosa. So this lamina cribrosa, in case of increased intraocular pressure, when the intraocular pressure rises, this actually bulges posteriorly. Okay, and the condition of intraocular pressure is actually called as the glaucoma. It is actually called as the glaucoma. Then apart from this, the sclera is also pierced by long posterior ciliary vessels along with the optic nerve. You are able to see these are the long posterior ciliary vessels. Then apart from that, what else actually pierce the sclera? So anterior ciliary vessels, you are able to see here near close to the limbus or the sclerocorneal junction. So they are mainly derived from the muscular vessels which is actually supplying the recti. And then you also have choroidal veins which forms the venae varicose or whorls of veins behind the sclerocorneal junction. Varicose vein mainly it between midway between the optic nerve and the what do you call the limbus sclerocorneal junction. You are able to see these are the varicose veins. Okay, so the choroidal veins they are whorl like veins. Okay, venae varicose. Next, coming to the anterior 1/6 is formed by the cornea, a transparent membrane. You know why it is transparent? Because of the lack of blood vessels. Okay, so forming the outer coat, this is actually thick at the periphery compared to the center, because at the center the thickness is only just 0.5 mm, whereas at the periphery it is actually 1 mm in thickness. So the convex forwards, you're able to see it is mainly convex forwards and presents a sulcus, as I told you, at the sclerocorneal junction, that is called as the sulcus sclerae. So coming to the layers of the retina, I'm not mainly going into the details of the histological part. So you are able to see the sulcus, which also marks the position of the limbus or the sclerocorneal junction. So the layers of the cornea, if you look at it anteriorly, you have the corneal epithelium. Okay, so you see the corneal epithelium, which is a stratified epithelium, and deep to that you have a limiting membrane. The anterior limiting membrane is actually called as the Bowman's membrane. Then you have the corneal stroma or the substantia propria. Okay, so mainly made up of collagen fibers which are uniformly arranged. Okay, substantia fibra. Then you have the posterior limiting membrane, or also called as the Decimet's membrane. And then deep to the posterior limiting membrane, what you have is the endothelium. Okay, so the Decimet's membrane, okay, or the posterior limiting membrane is actually acellular, and it is homogeneous, again collagenous layer. So at the periphery what happens is they actually project to form the trabecular tissue which forms the inner wall of a sinus venosus. Okay, so here you have a canal which is actually called as the canal of Sclem, which is actually called as the canal of the Sclem, and it gains attached to an extension of the sclera which is called as the scleral spur. So here you are able to see that is the scleral spur which actually projects front and medially. Okay, so this Decimet's membrane forms a trabecular tissue which gains attachment to the scleral spur. So the space between these trabecular tissue, you are able to see the space between this trabecular network contains the canal of Sclem at the iridocorneal angle. Okay, because here you are able to see that is the iris. Okay, and the cornea, the junction of the iris and the cornea is actually called as the iridocorneal angle, and from which there is a small canal spaces between the trabecular tissue. So it is actually the space in the Decimet's membrane. So the trabecular tissue actually forms spaces between them, and that is called as the canal of Schlem, through which the aqueous humor is drained. So the aqueous humor is actually drained from this. Okay, then not only that, some fibers of the trabecular tissue are also attached to this, what do you call, the scleral spur. Okay, so it is attached to the scleral spur as the pectinate ligament. Okay, so from the scleral spur they actually pass to the periphery of the retina as the pectinate ligament. Okay, so that is about the uh, 5 layers of the cornea: corneal epithelium, Bowman's membrane, and then you have anterior limiting membrane, also called as, this is called as the stroma, corneal stroma substantia propria, and then you have the Decimet's membrane and the posterior limiting membrane. Okay, and that is called as the more deeper to hit. What you have is the corneal endothelium. It is again a single layer of cuboidal cells which covers the posterior surface of the cornea. Okay, the cornea is actually avascular. So because of its avascular, there is also no lymphatics in the cornea. Okay, but it has got a very rich nerve supply, sensory nerves, which are actually branches from the ophthalmic division of trigeminal nerve. So even though it is avascular, so it receives its nutrition. The cornea mainly receives its nutrition from the aqueous humor. So you are able to see in front of the iris, the anterior chamber is filled with the aqueous humor. So from that, the posterior layers of the cornea receives its nutrition, whereas the anterior layer mainly receives its nutrition from the lacrimal fluid. Okay, and also capillary loops at the conjunctivo-corneal junction. So as I told you, rich nerve supply from the branches of the ophthalmic division, that is the long ciliary nerves. So what is actually corneal reflex? So you take a piece of cotton and then you touch the cornea. Immediately what happens? Your eyelid closes or blinks. Not only the eye where you have touched with the cotton wool, both the eyes they close, and that is called as the corneal reflex. Because the ophthalmic nerves, as I told you, the sensory nerves, from they actually go and reflect via the trigeminal nerve to relay into the main sensory ganglion. So that will have connections with the afferent limbs of the facial nerve. So the motor response through the facial nerve goes and then it contracts your orbicularis oculi muscle. So thereby what happens? The eyelids close, blinking. So mainly, why the transparent, or how the cornea is kept transparent? One reason, that is it is avascular. Then second thing is it is got a smooth epithelium. Okay, so the epithelium is not irregular, and they are all smooth epithelium. Then in the corneal stroma, when you look at the collagen fibers, they are all uniformly arranged. So all this contributes to the transparency of the cornea. And because of the absence of the blood vessels, the cornea transplant, allogenic transparent of the cornea, there is no graft rejection, because no antibodies are actually produced against the donor's tissue. So, so I will again coming back to the sclerocorneal junction. It is also called as the limbus. Okay, the sclerocorneal junction is also called as the limbus, which is present within the substance of the sclera. So it is present within the substance of the sclera, and close to the limbus and periphery of the anterior chamber only. You see a small canal which is actually called as the canal of Schlem or sinus venosus sclerae. Okay, so an endothelial lined canal which is called as the canal of Schlem, or it is called as the sinus venosus sclerae. So the boundaries of the canal, the outer wall is actually marked by the sulcus in the sclera, scleral sulcus, and the inner wall. Okay, so it is marked by a sulcus sclera. So this is actually called as the canal of Schlum, and the inner wall anteriorly it is mainly formed by the trabecular tissue, which I told you, which is an extension from the decimates membrane. Decimates membrane, and the posterior part is mainly formed by the scleral spur. So, so that area you are able to see an extension. The sclera extends forwards and medially, called as the scleral spur. The scleral spur also, when you look at it, the internal aspect of the scleral spur gives attachment to this ciliary muscle. The internal part of the scleral spur actually gives attachment to the scleral muscle. Outer part, actually what happens is the trabecular tissue. Okay, so from here you are able to see the iridocorneal angle between the cornea and the iris. So from here the aqueous humor has to be drained into the canal of Schlum. Okay, so mainly what happens, it actually collects the aqueous humor from the anterior chamber of the eye and the iridocorneal angle, and from there what happens, the aqueous is drained from the sinus through the anterior ciliary veins. So through the anterior ciliary veins it drains, and usually there is no blood inside this. Okay, but sometimes blood might get regurgitate, and if it is the sinus is getting blocked, and then naturally what happens, tremendous pressure develops inside the eye, and as I told you, it is called as the glaucoma. Okay, so that is the scleral spur which you are able to see here. Okay, triangular projection gives attachment to the ciliaris muscle posteriorly. So this canal drains the aqueous humor at the iridocorneal angle, which is also called as the filtration angle. So conjunctivitis is actually redness of the eye. It might be due to viral conjunctivitis, or it might be due to bacterial conjunctivitis. In bacterial conjunctivitis mainly you are able to see the crusting forms. So the secretions, what happens, they get dried up, and you are able to see mainly the crusting forms. Next is white ring around the sinus, mainly cornea. It is called as arcus senilis in aged persons. Then cornea becomes opaque. Sometimes it should be actually transparent. If it is opaque, which is called as the corneal opacity. So this might also be due to many reasons. Any aberrations, most commonly aberrations are injury to the cornea, or sometimes certain drugs also might, if you used for a very long period of time. One common drug is actually the hydroxychloroquine, which is now famous a few days back, HCQS. Okay, so the hydroxychloroquine, if used a prolonged period of time, it might get accumulated, and that might also lead to corneal opacity. So infections of the cornea is called as keratitis, and thinning of the cornea is called as the keratoconus. So corneal transplant, so graft from the deceased person. So what do we call it as eye donation? Eye donation is mainly what happens, the cornea from the deceased person is actually transplanted to the affected recipient, and it actually has got a very good what do you call results, because of there is no auto rejection of the graft due to the absence of blood vessels. So all these blood vessels which you are able to see is actually in the conjunctiva. Okay, they are not cornea. You are able to see anterior to the cornea, you have the conjunctiva. In the conjunctiva, you can see the blood vessels. So we are actually passing on to the next intermediate tunic, which is actually called as the choroid, the middle coat, which is rich in blood vessels and also called as the vascular coat. So it consists of blood vessels and also pigmented cells, and because of that it is actually called as the uveal tract. Uvea or uveal means grape. One place where we come across is uvula, which hangs like a bunch of grape, which you are able to see in the soft palate. It appears like a grape, no, black grape, and if you peel off the outer skin of the grape, inside you will see white jelly like. So here also interiorly this vitreous humor, you can see, of course, the retina is intimately attached to the inner aspect of the choroid. So it resembles like a grape, so that is why it is actually called as the uveal tract. So choroid or the middle layer mainly consists of the choroid, and then anteriorly you see the ciliary body and the iris. So these three mainly form the choroid, and this choroid is actually sandwiched between the sclera and the internally the retina, separated from the sclera by the suprachoroid lamina, separated from the sclera by the suprachoroidal lamina, and posteriorly it is pierced by the optic nerve. So it is pierced by the optic nerve, and at this place it is very tightly adherent to the sclera, and it is continuous with the pia and the arachnoid matter. It is continuous with the pia and the arachnoid matter. So here you are able to see mainly it is made up of the blood vessels. Okay, so the choroid is actually the uveal tract layer which is forms the posterior 5/6. Okay, so posterior 5/6 of the eyeball. Anteriorly you have the ciliary body, and then the what do you call iris. Okay, so you are able to see the numerous vessels, mainly your posterior ciliary vessels, which actually pierce their branches. Here you are able to see the anterior ciliary vessels. So they mainly form two arterial circles, minor arterial circle and major arterial circle of the iris. Then you are able to see the veins, anterior ciliary veins and posterior ciliary veins. They are actually draining into the ophthalmic veins. Okay, you are then these are actually verticosae, venae verticosae, which are actually arranged in whorls. Okay, and they drain into the, you are able to see, draining into the ophthalmic veins. Now coming to the structure of the choroid, mainly it consists of four layers. The four layers from exterior to interior are the suprachoroidal lamina, which actually it separates from the sclera, and that is called as the lamina of fusca. Then you have a vascular lamina, so layer of blood vessels with some pigment cells and supporting connective tissues. So the arteries are actually derived from the short posterior ciliary arteries, and veins converge to form them verticose veins. Okay. Then you have a lamina which is called as the choroidocapillary lamina, fine network of capillaries which nourish the outer three or four layers of the retina. Then you have a basement membrane which is actually called as the Buck's membrane. Okay, so to this Buck's membrane only the pigmented layer, the outermost layer, pigmented layer of the retina is firmly attached. In posterior part, in some animals you can see the specialized cells in the choroid, which is actually called as the tapetum. So these tapetum, what happens is, that is why when you actually in the nights when you travel, when your headlight projects into the eye of these animals, especially you can see in the tiger and lion, or in cattle also you come across, you see a greenish light when our headlight from our vehicle falls on to these animals in the night. They are actually called as the tapetum. Okay, so the four layers, as I told you, suprachoroidal lamina, then you have the vascular lamina with the blood vessels, capillary lamina, fine network of capillaries, and then the basal lamina called as the Bruch's membrane, attached intimately to the pigment layer of the retina. Then tapetum is actually special cell seen in animals. Next, coming to the ciliary body. So it extends as a complete ring. You are able to see it extends as a complete ring from the anterior part of the choroid. So this is actually your retina which you are able to see, and that is the choroid. From the anterior part of the choroid, it extends from the ora serrata. So this is the serrated margin which you are able to see here, and that is called as the ora serrata, and to the periphery of the iris at the sclerocorneal junction. So mainly you are able to see it provides attachment to the suspensory ligament of the lens. It provides attachment to the suspensory ligament of the lens. It is more thick in front and thin behind, and it is triangular on cross section. Okay, it is mainly triangular on cross section. It mainly consists of ciliary ring, ciliary processes, and then the ciliaris muscle. Ciliary ring, which is pars plana. Then you have ciliary process. Posterior part is actually pars plana. Then the anteriorly you have the ciliary processes, which is called as the pars placata, and then you have the ciliaris muscle. So here you are able to see the ciliary body, which is somewhat triangular in cross section. So posterior part consists of ciliary ring, and anteriorly you are able to see 70 to 80 ciliary processes. Okay, so this is the ciliary processes which forms the pars placata in the anterior 1/3. Posterior part you don't see this process, and it is smooth, called as the pars plana. Okay, so these 72 ciliary process, they radiate from the periphery of the iris. So this is the iris which you are able to see here. So the elevation of these process rests in the grooves of the anterior, what do you call, grooves of the suspensory ligament of the lens, and the spaces in between these grooves gives attachment to the zonular fibers of the lens. Okay, and these zonular fibers, you are able to see it is extending posteriorly and encroaching on the pars plana. Okay, pars plana. The inner surface of these ciliary process, they extend into the posterior chamber. This is the anterior chamber, whereas this is actually called as the posterior chamber. Okay, so that is actually the posterior chamber which you are able to see here. To the tips of the ora serrata. So it extends up to the tips of the ora serrata. Okay, so the part of the retina which is actually extending onto this ciliary body is also called as the ciliaris retina. Okay, and then it also continues to the posterior surface of the iris. So mainly not the whole layers of the retina, they extend only the anterior 2 to 3 layers, which is the non-cellular part of the retina, which extends as the ciliaris retina. So pars placata, which consists of ciliary process, and then the pars plana, which you see here. So the inner surface mainly secrete the aqueous humor. Okay, so mainly the inner secrete the aqueous humor. So now that is what you are able to see here, the ciliary ring, pars placata, and then the pars plana. So the zonular fibers attached between the grooves between the ciliary process and extend into the pars plana. So this is actually the retina when you view it from behind. That is the retina. Anterior part shows a irregular margin which is called as the ora serrata. Beyond this, retina extends into the ciliary part. Only the anterior 3 or 4 layers they extend. So then you have the ciliaris muscle, 3 types of fibers. You have circular fibers, okay, and then you have meridian fibers and radial fibers. Okay, so contraction of these muscle, what happens, brings the suprachoroid lamina along with the ciliary process to move forward. Okay, so the suprachoroid lamina along with the ciliary process will move forward. When these move forward, what happens is the lens will be relaxed because of the suspensory ligament of the fibers are relaxed. Are you able to understand? So the lens gets bulge, and it adjusts for the near vision. So the ciliaris muscle is actually a muscle of accommodation. Okay, there is no opponent to relax this. Uh, when the contraction is actually released, then it comes back to normal position, and the ligaments are tensed, and that brings the lens to its original position. This is mainly supplied by parasympathetic fibers through the short ciliary nerves arising from the ciliary ganglion. So the ciliary ganglion receives preganglionic fibers from the Edinger-Westphal nucleus. So all this we have discussed in detail in the orbit class. Okay. So next, coming to the iris. So here you are able to see a circular pigmented contractile diaphragm. Okay, because what happens is the iris in front, what happens is the iris also encloses an aperture which is actually called as the pupil. So the pupil actually can be this aperture can actually what happens increase or decrease in size due to the contraction of the iris. Okay, so it is a circular pigmented diaphragm and submerged in the anterior chamber filled with the aqueous humor. Not anterior chamber, it is actually the anterior segment, because this divides the anterior segment into an anterior chamber and posterior chamber. Okay, so it is mainly filled with aqueous humor and presents a circular aperture, as I told you, called as the pupil, and periphery is attached to the ciliary body. eh? And in front you are able to see that is the iridocorneal angle from which the aqueous humor is drained, but the aqueous humor is actually secreted in the posterior chamber. So lateral to this attachment, as I told you, the iridocorneal angle is present. So mainly what are the layers of these the iris? So as I told you, it is mainly anterior surface is not covered by any distinct endothelium. Okay, but mainly it consists of mesothelium. So you have an anterior mesothelium, and then you have the stroma of the iris. Okay, mainly made up of collagen fibers, tissue spaces, fibroblast, and a lot of melanocytes and vessels and nerves. Okay, and you are able to see that two arterial circle, you are able to see the minor and major arterial circle, you are able to see in the iris, and it also consists of two sets of fibers. One is the sphincter pupillae and other one is the dilator pupillae. Okay, so the sphincter pupillae is mainly responsible to constrict this pupil, and dilator pupillae is to enlarge the pupil. Okay, then as I told you, inner to it, deeper aspect of the pupil, the pigmental layer is continuous retina. So here you are able to see two types of fibers, that is the constrictor pupillae made up of circular muscle fibers, and it is supplied by the sympathetic from the ciliary ganglion only. Dilator pupillae is mainly made up of radial fibers and dilates the pupil, supplied by the sympathetic fibers which is arising from the superior cervical ganglion. If you actually place a drop of atropine on the eyeball, naturally what happens is the iris dilates, and thereby what happens is the you can actually examine the fundus of the eye through an ophthalmoscopic view. Okay, because this actually counteracts the neurotransmitter, blocks the neurotransmitter acetylcholine, the atropine. Okay, now in certain cases these pigment cells are absent, and actually what happens, the iris will appear pale. Okay, the iris might appear pale. Actually it is not white, it is pink, because absence of pigment, it is pinker in nature because of the blood vessels you can see. Okay, the iris is mostly brownish or black in color due to the abundance of these pigment cells, melanin pigment cells. If the pigment cells are very less or somewhat what do you call less distributed, then it appears actually blue in nature. Okay, it is actually blue in nature. Okay, now sometimes you are able to see a persistent pupillary membrane. Okay, from the iris you are able to see a persistent the pupillary, because the pupillary membrane actually has to rupture. If it is present persistently, then it is called as persistent pupillary membrane. And coloboma iris is another congenital defect. You are able to see from the pupil iris, you are able to see that extension like a cat's eye. This is actually the choroid fissure which has not fused, and that is the actually another congenital deformity which you come across. The pupil actually appears black. This is because the rays of the light that are reflected from the retina, what happens, are refracted by the lens and then the cornea and go back to the source of the light itself. Okay, So a cleft in the iris only which you are able to see as the coloboma iris. So next we are passing on to the innermost coat of the eyeball, which is called as the retina. So the retina is the nervous coat and extension of the diencephalon directly and continues posteriorly, piercing the eyeball as the optic nerve fibers. It is called as the optic nerve fibers. So it is present deep to the choroid, and the outer two to three layers is actually very much adhered to the basement membrane of the choroid. But more medially, what happens, you have another membrane called as the hyaloid membrane, which separates this from the vitreous humor. So two parts, mainly the nervous part of the retina. You are able to see the inner sensory layer, which has got all the 10 layers, whereas the outer part of the retina, uh, you are able to see the outer part of the retina, mainly the pigmental layer. Okay, so anteriorly, what happens, the anterior part, commencement of the anterior part and the posterior part junction, you see an ora serrata, an irregular edge. So that is actually called as the ora serrata. Beyond this, only the non-cellular part is reflected onto the inner aspect of the ciliary body and the iris. So the 10 layers of retina, mainly anterior pigmental layer or outer pigmental layer, mainly consist of a lot of melanin pigment cells. Then you have the layer of rods and cones. So they are mainly, cones are for the discriminative vision and rods are for the color vision. Okay. Then deep to it you have a membrane which is actually called as the external limiting membrane, and then you have the outer nuclear layer which consists of the cell bodies of these rods and cones. Okay, so from there the central processes forms a nerve plexus which is actually called as the outer plexiform layer. Okay, so they are all bipolar neurons. So all specialized sensations, you have bipolar neurons. And from there you have inner nuclear layer, are actually mainly called, their cell bodies of these central process are present, and then they form an again plexus which is called as the inner plexiform layer, and then you have the layer of ganglionic cells. So the axons of these ganglionic cells only forms your optic nerve fibers, and it is limited by posteriorly the inner limiting membrane. Okay, so these are the layers of the retina. So fovea centralis, you are able to see a depression in the posterior part of the retina. So from here to the anterior pole is actually your visual axis. So fovea centralis, where the rods are absent and only the cones are actually present. It is also called as the macula luteal yellow spot. And then more medial to it, what you see here is the optic disc where the optic nerve pierces. Okay, here rods and cones are absent and it is also called as the blind spot. Okay, so the blood supply to the retina deeper layers is mainly from the central artery of the retina, which supplies the inner layers, whereas the superficial layers, it is a diffusion from the capillaries present in the choroid layer. Okay, so veins, actually the central veins of the retina mainly drain into the cavernous sinus or through the, mainly through the ophthalmic veins. So coming to the clinical aspects of the retina, so one is a retinal detachment. So separation of pigment and photosensitive layer. So you are able to see these irregular margins in retinal detachment. Then in diabetic retinopathy, the blood vessels to the retina gets damaged, and you can see the retina swells and some deposits are formed. So in uncontrolled hypertension, again what happens? Thinning of the arterial wall might takes place. Okay, so all these might lead to loss of vision. So sometimes what happens, uncontrolled hypertension, the central artery, the retina might also gets ruptured. That also might also lead to total blindness because it is an end artery. So here are able to see the macula lutea or the yellow spot, and that is the blind spot through which the optic nerve emerges out and all the blood vessels entering in, you are able to see through an ophthalmoscopic view. So cancers of the retina mainly affecting the children is actually called as the retinoblastoma or intraocular malignancy. Glaucoma is increased intraocular pressure. So the intraocular pressure should be around 15 to 20 mmHg, and the veins draining in the canal of Schlump there, actually the veins should be above 20 mmHg. Okay, so if the intraocular pressure rises, because if it is not drained, fluid buildup inside the eye, and what happens, it might lead to a condition called as glaucoma. So it damages the optic nerve, and first the peripheral vision will get affected. That is called as the tunnel vision. Periphery, you see a blackout, only the central vision is present, and if it is left untreated, and it might also lead to complete loss of vision. So next, short account of the lens. So you are able to see the lens is actually a biconvex structure and more bulged posteriorly, and it is covered by a capsule which is called as the lens capsule, and it actually divides the inner aspect of the eye into an anterior and a posterior segment. Okay, so that is the anterior segment and the posterior segment. It is considered deep to the capsule. You have a single layer of the epithelium cells, mainly forming the lens cells. They are cuboidal in nature. At the periphery, what happens is these cells elongate as the lens fibers. Okay, so the fibers mainly are present in the form of the concentric rings. Okay, so they are mainly present in the form of concentric rings, and oldest fibers at the center are present, and they are hard, and they also form a structure which is called as the crystalline. So the lens is suspended by the lens fibers, which is getting attached in the grooves between the ciliary process, and naturally the lens is actually made convex, bulged out uh, through the contraction of the ciliary muscles for accommodation. So all these things we have already discussed in the ciliary body. So clinical aspects, mainly what is presbyopia. So the lens gets hardened in old age and leads to presbyopia. Okay, so thereby what happens is you use a reading lens, um, or sometimes if you have other conditions associated like myopia, then you use a bifocal lens. It is a refractive error due to abnormal shape of the cornea. Okay, abnormal shape of the cornea, you are able to understand, or the lens. So what happens in case of myopia, the eyeball itself is a little bit longer, and what happens, light falls in front of the retina. Okay, so because of that you will have only near vision, far vision you will not be having. Whereas in hypermetropia, the eyeball is shorter and the rays pass beyond the retina. So what happens, you will not be able to see near objects. It is the opposite of myopia. Astigmatism is abnormal curvature of the cornea or lens, and it is seen normally in children and adolescents, but if it is present in adult, it is actually called as astigmatism and also leads to blurry vision. So chambers of the anterior compartment in front of the lens, you are able to see that, which is divided by the iris into anterior chamber and posterior chamber. So the anterior chamber is between the cornea and the iris filled with aqueous humor. Posterior chamber is between the iris and the lens, and both communicates, the anterior and the posterior chamber communicates through the pupil. So the aqueous humor secreted by the ciliary body nourishes the cornea, and it is drained by the canal of Schlump. So the posterior uh, compartment is actually filled with vitreous humor. Okay, and it is actually surrounded by the retina, and you have a membrane separating the vitreous humor from the retina, which is called as the hyaloid membrane. That membrane actually shows a depression anteriorly called as the hyaloid fossa to accommodate the lens. Okay, so a depression in the center for the lens. So vitreous humor again maintains the shape of the eyeball, and it is traversed by a canal, hyaloid canal. Developmentally it has the artery, that is the hyaloid artery. So thank you very much for the patient listening, and that is all for today's class.